to the need for scalable solutions. Technology and AI can play an important role in improving healthcare systems and reaching more communities. To guide us through this topic, we are honored to have Kartik Dhar, Chief Technology Officer at Project ECO. ECO stands for Extension for Community Healthcare Outcomes, a global model that uses technology to connect experts with healthcare providers and expand access to quality care. Karthik, please note this presentation is being recorded for the benefit of the participants. Over to you, Karthik.
Thank you, Payal, and it's amazing to be here. Thank you for having me, and good to see Varsha, so many familiar faces here, and such an amazing audience. So, thank you very much for having me. I'll share a little bit about myself and the organization that I work for, which is called Project Echo. So, I serve as the Chief Technology Officer at Project Echo. We are a global non-profit organization. We work primarily in healthcare. We work primarily to democratize the access to best practice knowledge, and we do this around the world in over 190 countries. And the backbone of our knowledge sharing network is this digital platform we call as iEcho. And I can share a little bit more about that, our journey, and how we are using technology for good to improve people's lives. And we can also talk a little bit about AI and some of the future opportunities which we are currently working on. So allow me a minute. Let me just share my screen. All right. Is my screen visible?
Yes, yes.
Oh, thank you. So first, just a little bit of context as to why this is important. We live in a day today, 2026, a lot of advancements have happened in healthcare, but even now we see that every day there are so many cases of people dying from diseases which we know how to treat. We have the tools, we have the medicines available, but even then, you look at, TB is a huge problem in India, of course, in many parts of the world. In Africa, the bronchitis and pneumonia. There's also HIV and many other communicable diseases. Basic things like diarrhea, and 15,000 children are dying before their fifth birthday every single day. So this is very sad that with all the advancements, all the vaccines, all the medicines, all the everything that is available, there is still this gap which exists, especially when we look at the global south, when we look at underserved parts of the world. Um, and that is how we stay motivated as to what can we do at Echo to solve this problem. And so a little bit about Project Echo. We started about 20 years back, and the idea was very simple, which is to move knowledge and not moving patients. And what does that mean? Basically, that wherever you have a problem of dynamic complexity, so for example, tuberculosis. So what do I mean by dynamic complexity? It means that the problem is complex itself. For example, in TB, if you give some medication, then there may be some side effects, there may be some other complications, but it's also dynamic in the sense it is changing all the time. New drug-resistant bacteria come in, the bacteria is evolving, it is the drugs have to constantly change, the guidelines keep changing. We saw this during COVID also, where the different strains of the virus would come in. Many of you may remember, the various, the Delta variant, this variant, that variant. So always the science is evolving, and whenever there is such a problem which is complicated and it requires a lot of dynamism to it, then we need some intervention which can bridge that knowledge gap. Because the knowledge exists. The challenge is getting the right knowledge to the right place at the right time so that people can benefit. So that is what we are trying to do at Project Echo, and we want to use technology to solve this problem. Our mission is very simple. It is, like I mentioned, to democratize the implementation of best practices for healthcare. And we've also recently expanded into education and climate and agriculture. But primarily, we focus on healthcare, and that's what I will talk about mostly today. And we want to do this for underserved people, and we want to do this all around the world so that basically language or region or geography should not be a barrier to access to healthcare. So I'll share a little bit about how we came up with this idea of the sort of echo model, which is what the sort of core idea behind Project Echo was. So if you look at the problem, like we mentioned, TB, there's a lot of expertise which is available in the ecosystem. You have different types of experts, doctors, there could be lab technicians and other types of experts also. But how do you make sure that it's not just you're giving information to people, but it is being actionable? It is something which people are practicing in their daily lives. So we created this idea of a hub and spoke model, which is to create what we call as a community of practice, where people are sharing ideas with each other, discussing real problems, and then doing this over and over again. So it's not just a one-time webinar or some kind of a training program, but it's a lifelong learning experience. And people, by discussing these patient cases once a week, usually on a live session in small groups, sharing with each other, sharing ideas, learning from each other. A lot of times, the experts don't have the idea of what will work in the field. So it is also creating new knowledge, and which may not always be there in the textbooks. So how do we move from just textbook knowledge, which is just theoretical, to actual practical implementation rather in the field? That is what we aim to do. And so, for example, in Echo, what happens is the participants who are doctors or lab technicians or nurses or community health workers, they will take part in these interactive learning sessions, and they will present real world patient cases. So if I am a TB doctor, then I will say, this patient came to my clinic. Here's the challenge I'm having. These are the drugs I gave the patient, but it is not working. I need some help. And then other participants may share their perspective. We have a multidisciplinary expert team who will share some ideas. And then over time, people build the capacity. They learn from the experts. They learn from each other also, which is what we call as all teach and all learn. So everyone is an expert and everyone is a learner at the same time. And the end goal is that in this case, the patients of TB will be benefited because we can diffuse that knowledge implementation into the ecosystem. And we can do this at massive scale when supported with a digital platform. So where does technology fit into all of this? So moving back a little bit to about 2019, right before the pandemic, we wanted to have this ambitious goal of reaching 1 billion lives. So that was our target at the time. And of course, you can only achieve that kind of scale when you have, technology as the backbone of what you're doing. So we asked a simple question, which was, how do we scale this model to impact 1 billion lives? But the question is always, instead of thinking about how we can scale the model, how do we enable frontline workers, which is the doctors, clinicians in the world? How do we empower them using technology so they are at the center of what we are doing? And instead of thinking how can we impact the 1 billion lives, how can we ensure that our frontline workers can impact uh, as many lives as possible? And how do we use technology to empower them? So that is a very fundamental shift in the way we think about technology. And we learned from various what we call as societal platforms, and you may have heard from others as well. How do we stop keeping yourself at the center of everything, but put yourself in the shoes of the clinician in the field and learn from their experiences and use technology to make their lives better? And we learned from our partners who are working on this idea called societal thinking, which is, and there are a lot of principles around this, but thinking about what works at scale is not just scaling, what you're already doing. And this is a very fundamental shift in our thinking because Echo had been going around for 20 years or so. but it was just running one program at a time. We would do one program for TB and then one program for cancer and then one for mental health. And we would partner with organizations to do these. So we would partner with AIMS or with NIMHANS or various institutions, medical colleges, Ministry of Health, etc. But that is only a incremental sort of linear growth curve, right? How do you take a linear growth curve and make it into an exponential growth curve? That requires a fundamental shift in our thinking. And that is where the idea of societal thinking came around, which is how do we look at firstly building public goods? So digital public goods, so, like Aadhaar is a digital public good, UPI is a digital public good. These are sort of infrastructure layers which are open, interoperable, which can work with other systems and allow other people to integrate and build on top of it. So we are not sort of creating a closed system which only works in itself. Like many of the large tech companies, for example, they create these closed systems, right, which only will work if you have this phone or this laptop, then it will work nicely. If you use this app, then it will work. But they don't think about interoperability. They don't think about the ecosystem, and they're not designing for openness. Second is how do we catalyze interaction? So for us, the key part of Echo is not the learnings which we are providing to partners, but how the ecosystem is learning from each other. So rather than focusing on Echo trying to solve TB or cancer or mental health or whatever the problem is, how do we enable that frontline worker to interact with another frontline worker to share their ideas and catalyze the interactions, do this at scale so that we are not the bottleneck and it can scale organically. Third is how do we restore the access and choice back to our users? So what does that mean? Like a lot of times in these kind of hierarchical systems, the controls are always at the top. Like there'll be a government or there will be some control which will design, okay, here is the program, here's what you have to do, but very little thought is actually given into what is the challenge which that particular doctor or ASHA worker or nurse is facing. So how do you give them the access to choose their own challenges, their learning paths, their issues, so that we can find the right program which suits their needs? Otherwise, if it is just a top-down approach, then we end up with these one-size-fits-all kind of solutions, which don't always work in that particular field. Because the TB doctor in Tamil Nadu may have a very different set of challenges from a TB doctor in, say, Haryana. So we don't always know that, but they will know what their challenges are, give them the agency and the access to solve their problems. And lastly, inspiring co-creation in this ecosystem. So when we say co-creation, what I mean is Echo is not trying to solve all the problems, right? We work with our partners. We work with the government. We work with experts. We work with medical colleges. But more importantly, how do we ensure that these organizations collaborate with each other so that we are not reinventing the wheel? If there is expertise in some particular domain, how do we encourage that expertise to flow seamlessly into the ecosystem? So similar to how in Wikipedia, basically multiple people can edit a document and people share their expertise and collaborate and co-create the same thing instead of different people just creating different pages. You basically work on the same product. And how do you do this at scale so that we are not reinventing the wheel? And most importantly, distributing the ability to solve problems instead of distributing solutions. That is the core of this philosophy. And we have learned this the hard way because we tried, we always have this sort of idea that we have to solve all the problems. Like we must solve, COVID or mental health or cancer or whatever. But a lot of times the ability to solve these problems is already there in the ecosystem. Our job is only to enable them and distribute the ability for them to solve the problems and do it more scalably than whatever we can do. So we basically take a step back and let the community drive these solutions. So we had been doing Echo for about 20 years, and then we realized, okay, we have to really change our way of thinking and sort of adopt a new strategy to take this to the next level. And that is where we created this idea of the digital platform, which we call as iEcho. So this is a digital platform which we built from the ground up using the principles of societal thinking, a cloud-based platform. It's available at on the web and on mobile and on Android. But it's not just about building an app, because you can build an app, but just the app on its own will not do much unless we really think through it from the perspective of how these interactions are happening, how the ecosystem will adopt it, what are the potential integration opportunities, and make sure that it's following all those principles. So we've been doing this for a few years now. And when we started this journey, we had a few very simple objectives. Like, why do we need a digital platform when all we're doing is just, people talking and sharing with each other? But the thing is, if you're trying to do this at massive scale, then we want to make sure we are firstly eliminating barriers to participation. So, for example, language becomes a big barrier. In India, we have so many different languages. Globally, there are even more languages. How do we make sure that one doctor who in some part of India speaks a certain language can interact with another doctor who does not speak that language? And how do we leverage technology to reduce those barriers to participation? How do we make sure that geography is not a barrier to entry? Access to mobile or like a smartphone or some kind of technology like laptops, etc., is not a barrier to entry. There are a lot of these systemic barriers, especially when we get into underserved communities, which we often take for granted. So how do we make sure that we are being cognizant of these and make sure that technology is not a limiting factor, but it is an enabler rather? Second, how do we make it faster for our partners to launch their programs? Because a lot of times our processes have been very manual. You have to fill up some forms, registration, compliance, then some certification, etc. But using technology, we can really accelerate these processes. We can automate things. We can use AI to automate a lot of these processes as well. That is something which we try to work on every day. Third, from a partner's perspective, how do we amplify the impact of their operations so that productivity is increased? We are not trying to just do, manual repetitive tasks like tracking attendance in programs or issuing certificates or all these things which systems can basically automate, so that our partners can focus more energy on actual program implementation, on delivery of the content, on planning the curriculum, and more value added things than these kind of mundane tasks, right? And last but possibly most important, I would say, from our perspective, is to build community throughout the movement, right? That is what we do at the core of Project Echo, is building communities of practice. And that is where technology, instead of sort of just taking away from human interaction, how do we use the technology to encourage more human interaction? And that's a very tricky balance sometimes, because the more we sort of try to automate things, we reduce friction, we reduce barriers, but then that human touch sometimes gets lost. So that is a very tricky balance which we try to maintain. Use technology to get people to talk and share with each other and do it more instead of taking away from human interaction. And our goal of all of this stuff is not to just create a technology product, because we are not a tech company. We basically look at ourselves as building a trusted human network of frontline workers, of experts, of practitioners who can use our technology to improve their learning outcomes, interact with each other, share this, and do this at massive scale. The core part is not the technology. The core part, for us at least, is the human network. And if we are able to leverage technology to make that more successful, then that is what we aim to do. And our thinking behind this is, instead of building, of course, we have apps, but fundamentally the integration point is what the platform provides, which is, think of IECO as like the foundational layer or digital platform, which then allows this network of partners, of ecosystem providers, of participants, learners, practitioners to integrate and interoperate with each other, to share ideas, discuss. All of these interactions which happen in the network is actually what creates the real value. And the end goal of these interactions is that communities of 1 billion people are impacted. So our role only is at the bottom layer of this pyramid, right? We do not want to try to solve all these problems ourselves. We cannot solve the problems ourselves, because the moment we start getting into that middle layer, it is just not scalable. So that's where a lot of focus and thought on focusing only on creating the infrastructure which will allow the network to thrive and succeed on its own. So when we are designing a platform like this, which is used in 190 countries in different parts of the world and operates in all sorts of areas and geographies, etc. So accessibility is very important. So some of the learnings when we were designing the platform was we have to make sure that an ASHA worker in the field who does not have access to the best latest smartphone can use our application on a low end device, perhaps on a spotty 4G connection also. So how do we optimize the system for low bandwidth? How do we make sure that it stays connected and is usable even on any kind of different device? Mobile first design also, of course, integrating with WhatsApp as well. We realized that in India, WhatsApp is a huge penetration, and mostly our people are familiar with WhatsApp. So we use that for sending our integration points, our session reminders, and various use cases, which we've directly integrated using WhatsApp APIs. Language, of course, is a major barrier. So we made a conscious effort to design our entire platform to support over 25 different languages. So, all of course, the Indic languages, yeah, Asia is a big focus for us, Africa and Latin America as well. So, making sure that even if you have one expert in one part of the world who speaks perhaps Spanish, another person in a different part of the world speaks Portuguese or Hindi or Tamil, then they can share content with each other, they can interact with each other, the application supports them. That is what we're aiming to do. And technology now has gotten to a pretty good space where language is usually not a barrier in these kind of contexts. So, um, yeah, how do we reduce barriers of language, reduce barriers of network, devices, and also accessibility standards. So, for example, many of our users they have some disabilities. So, how do we make sure that keyboard navigation is there? We have voice-based interfaces, so people are not familiar with typing on a keyboard can also use the interface. So we of course have various web accessibility standards. So we've learned and tried to build it as accessible as possible, especially when you're operating at scale. Invariably, there are some edge cases which you've not thought of, and then we have to go back and then learn from that and then build it again. So I would say that is what it takes to build a scalable and sustainable platform which can work in different diverse contexts. Now, as we look to the future, of course, AI is a huge opportunity for us. We realize that, very, very recently, since this whole large language models have, disrupted everything over the last, I would say, 3 years or so. When ChatGPT came out in 2022, of course, everyone is trying to solve everything through large language models. And yes, the models have gotten pretty good, especially in healthcare. Also now, many people just share some uh, some symptoms or some health report, etc., with one of these AI systems, and then it is able to give you a decent summary, and it's able to give you some advice. And of course, it would not be medical advice in the classical sense, but it's still useful health information, right? So we were thinking about this, like how do we leverage this technology in a manner which is going to solve a real problem, but more importantly, it is going to keep our focus on building that trusted human network, because our focus is on building communities where doctors, health workers can share and learn with each other. Now, can some of that learning happen through AI? Absolutely. But we look at it as a synergistic approach, which is for some learning, you will need human to human interaction, guided practice, both synchronous as well as asynchronous learning, which is what we are working on. And how do we create a learning model over here which leverages AI as part of it? So, for example, if I am a doctor and I have a patient who comes to my clinic, AI can help me with some parts of it. I will then discuss my patient case with a group of experts and with my peers. AI can summarize those learnings, give me more insights, and then help me in my learning journey as a doctor get more and more and more advanced, right? So rather than replacing the entire human to human interaction with an AI. We are trying to see where all we can infuse some intelligence into the whole learning model. And once we have a learning model in place, the other important factor to keep in mind is trust, right? Because another challenge with large language models is that trust, of course, is a challenge because a lot of times they do make mistakes. There are some hallucinations. Architecturally, also, they are fundamentally a black box. We don't really know where this information is being sourced from, what was the training data. Many of these are closed models. So it's impossible to really say why is the AI actually saying this. So that is where Echo comes in because we have a trusted human network. We have trust markers for people. We know which experts are trusted, which institutions are trusted, which content is trusted. And then when you take a trusted data set of knowledge and people, and then you apply language models to synthesize that, then you end up with a product which is much more high quality and reliable than just a simple large language model, which of course may be prone to making some mistakes. And thirdly, how do we take this and use a growth model which can allow this to scale, which is to make it even more scalable, reducing time to entry and making sure it is more scalable as we are expanding both in different geographies and we get more depth in various parts of India and various parts of the world. Because at the same time, if you have a stronger model, you have more trust in the system, then automatically you end up with a more scalable solution, which you can then replicate. So uh, these are some of the things we are still working on them. It is very early days for us, but the end goal for us is that we don't think that AI will replace the need for doctors or the need for human connection or whatever. We want to create that system where people, yes, there is of course a big shortage of doctors and health workers. So there will definitely be some use cases where you would have to see a doctor earlier, maybe instead of going to the doctor, AI could give some guidance, and that's what we call in the industry as task shifting, right? So instead of the role of the doctors may change, the role of various health providers may change, the role of Echo will also change as not just creating knowledge networks where people are just talking to each other, but the focus on discussion more around things like guided practice and mentorship rather than just sharing information. Because I think one thing we have learned is that the age of just knowledge sharing, as in information sharing, is over because information can be shared very fast and very easily and accessibly through the AI systems now. But what the AI systems cannot do is create a sense of community, create trusted networks, create guided practice so that uh, health workers feel that they have the confidence to implement these technologies and these new interventions in their practice. Because a lot of times it's not just the ability to know, okay, what is the protocol for treating this disease? Because the protocol is there on the website and the internet will tell you the research papers and all that. But the challenge is when you're implementing it and you have a patient in front of you, then the doctor will need that confidence. And a lot of times that is built by interacting with experts and talking to people and sharing their expertise. And that human to human connection is something which we don't anticipate as going away with AI. In fact, we want to see how we can make that connection even more stronger using AI and do this a little more scalably. And lastly, I'll just say that there's a lot of talk around how AI will be taking jobs, or how AI can, of course, it will write code. It can, in some cases, give health advice and other things. But a lot of things will change, of course, right? So, for example, when I was growing up, and I learned how to write code, and of course, now the AIs are writing code for you. So the focus is less on, all right, did I put the right parentheses or the right semicolon at the right place? And because I think focusing more on solving problems, focusing more on how do we leverage these tools to write code better, to solve real world problems. Of course, understanding coding and programming is very, very important. The same way we learn arithmetic in school, but then we use a calculator and now Excel and other tools to do the uh, you know division or multiplication or whatever. But we still have to learn how to do multiplication and division in school. I think that's very important. Same thing with AI. I think if you look at it as a tool which we can use, whether it is building software, whether it is solving healthcare issues, it is just another tool. It is a very powerful tool. It can be used very carefully. It can be used in a not so careful manner also. So I think especially in healthcare, we have a big responsibility because people's lives are at stake. So we have to be very, very cautious of how the AI system is being done. Because if one mistake happens and someone happens to die as a result of it, or someone has serious medical issues as a result of it, then of course that's a terrible outcome. So the onus is much higher. The bar is much higher in terms of not making mistakes, making sure it is done responsibly, ethically, safely. So that's why we are investing a lot of our energy on building safe, ethical, transparent systems with trusted guardrails around it, so that you're making sure that the AI is not, hallucinating, coming up with things on its own. And this is, of course, a very evolving story now with agentic AIs coming in. There's every week there's some new model coming in, some new agentic technology coming in. So we just have to stay ahead of the curve, learn what we can, and make sure that we use things responsibly. And that's it. I will stop here. So you can take any questions. Thank you. Thank you again for your time.
Thank you, Kartik. I think that was very, very nice overview of how you play a role. Project Echo plays a role in the healthcare segment, especially connecting first mile practitioners with experts to minimize that access issue, as well as the ability to serve first mile uh, healthcare workers as well as patients in the last mile. Thank you. Payal, over to you. So we will take some questions. I think participants can start posing.
Participants, please post your questions. Kalpana says, Serve for Health, if not an app, what do you recommend?
So if you're referring to the technology platform to be used, then I didn't understand the question. If you could just clarify what the context is about the app exactly.
Yeah, Karthik, there's one
Okay.
question around examples related to healthcare. And
Mhm.
I think in that context, if you can maybe talk about any medical discipline, how
Yeah.
you mentioned TB in your talk. Yeah, maybe that as an
Mhm.
example too.
I will,
How,
yeah, I'll give an example of mental health. I think this is an interesting one because a lot of times when we create products, we are not sure how it will be used in the field, right? So I'll give an example of Bihar. So in Bihar, there was the alcohol prohibition, if we remember a few years back, and there was a lot of cases of alcohol withdrawal symptoms, and the doctors in the district hospitals actually did not know how to treat the case of the alcohol de-addiction. So then we tied up with Nimhans. We used a platform to connect all the district hospitals, the doctors over there. These are general practice doctors, right? They are not psychiatrists. They are not experts in mental health. But how do you mentor them with the experts from Nimhans so that the patients can be treated directly in the district only? They don't have to travel to the expert site. So we are able to reduce the referral rate massively in Bihar. Same thing with tobacco cessation. We have done in many other states, in Chhattisgarh as well, partnering with Nimhan. So mental health is one of those things where it's been very powerful, using the platform so that the patients essentially get the care where they are, and we are able to reduce the burden on these big tertiary care centers, right? Otherwise, if you look at All India Institute in Delhi or Tata Memorial Hospital in Mumbai, NIMHANS in Bangalore, and many other institutes, right? They are overcrowded because patients from all over the country are traveling there. And the district hospitals and the primary health centers are underserved because they don't have the staff who is equipped, right? So that gap is something which we've been able to solve for many diseases, but of course it continues to be an ongoing challenge which we are actively working on. All right, I'll take some questions from the chat then in the order. So we have a question, how can AI and telemedicine improve the accessibility and quality of healthcare services? I think definitely there's a lot of scope for AI and telemedicine. Of course, the government runs the e-Sanjeevani program. There are many other telemedicine programs in India. Uh, at Echo, we don't always focus too much on telemedicine. That is not the core of what we do, because one inherent limitation with telemedicine is that it is one doctor who is seeing one patient, and instead of the patient seeing them in the clinic physically, they are seeing them remotely, right? So it does reduce the sort of geographical barrier. Like I can be sitting in Delhi and patient, let's say I'm a doctor, patient is sitting in Lucknow, and now I can connect with him. But at the same time, you're not creating uh, additional transformation in terms of the scaling of the system, because there's still 1-to-1 ratio of patients to doctors. So our philosophy is that yes, telemedicine has its own place, but what is more important for us is how do we, one expert doctor, instead of seeing one patient, how can they train 100 general practice doctors so that you can create much more scalable impact. But of course, telemedicine has its place. AI with telemedicine definitely has a lot of place. Many startups and companies are working on creating, AI support solutions, both as clinical decision support systems, where the AI can essentially work alongside a doctor with some checks and balances to make the sort of experience of the doctor much more simple, straightforward, and also guide through some protocols and things like that. Yeah. From the perspective of this hackathon, how can we help in healthcare sector other than the knowledge network systems? As you said, it is already in abundance. So I mean, healthcare is a huge sector. I mean, it is what we are talking about is only one small part of the whole thing, right? If you look at the end-to-end spectrum, there is prevention of disease, which is a huge thing. Everyone talks about treatment and solving cancer and all these things, but a lot of the focus actually is should rather be on prevention of disease, which is everything we do. And there's social determinants of health, everything like, climate is important, air pollution in Delhi, in North India, especially where I'm from, is a huge contributor to health. There is everything we do, frankly, contributes to our health in some manner, right? So clean water sanitation also impacts it. So right from, prevention of disease, then early detection and screening of disease. So many companies using AI to detect TB, to detect breast cancer, etc., using various technologies, because radiologists are not always available in the villages. So detection of disease, then of course treatment, and then management and all that. So I would say it's a huge spectrum. There's government systems, there's private systems, there's tertiary care hospitals, there's primary care centers, there's doctors, there's nurses, there's so many problems. If you look at the entire gamut of it, that I think technology and AI definitely has an application in most of these places. Yeah. Anushka has asked, how do we think decentralization will play out in healthcare blockchain? Uh, I think that's an interesting concept. Like specifically, if we're talking about electronic medical records, looking at the Ayushman Bharat digital mission, of course, by the government of India has been a step in that direction, making sure that the patients are in control of their health records and it's not like centralized with one particular hospital. I think it's a little challenging, just the implementation of it, because see, technologies like blockchain require some technology, some sophistication. So till we are able to make it very easy to use and user friendly, I think these technologies will still be a little nascent. We've seen this in cryptocurrencies also. In healthcare, it just gets a little more complicated because we are dealing with people who honestly are not as well versed in how to handle some of these technologies, but I'm not fully aware of any blockchain implementations directly in the healthcare ecosystem yet, but perhaps that could be something to look out for. Right? Okay. Uh, Hopework Odisha asks, "Sir, what kind of game can we create for SR, HR, and mental health?" I'm not sure what is SR, HR. I'm not familiar with that. Uh, but for mental health, I mean, there are many, interventions which creating some sort of, chatbots and also virtual companions and things like that, which can solve some of these issues. I feel a lot of times the solution may not necessarily be technology also. I think we have to sometimes realize technology is not like a silver bullet where you try to solve everything with it also, because a lot of times these games and other things can worsen mental health outcomes. So it's a careful balance. So don't treat it just as a silver bullet, like, okay, to solve everything. But again, I'm not sure if there is a scope for gaming for mental health. Perhaps there could be something there. I'm not an expert in that domain, so I can't comment on it. Sorry. All right. Um, Sanya Khanna asks, as we have to reduce the language barrier for any project we create, so what are the key points we have to take care for reducing this language barrier? Okay, that's a good question. So I would say first thing is, whenever you're building an app or a platform, then the architecture has to be multilingual in design. So especially in your front end layer, making so that was one thing we had to realize, is no hard coding of plain text English strings anywhere. So everything has to go through this sort of a translation layer. And there are many open source technologies which help you with this. So we use React, we use various libraries which would basically creating a pipeline of translations. We use AI and Google Translate and other systems. So basically, design keeping in mind that the same application has to be built in English as well as in Hindi as well as in Punjabi or whatever, and do that from the ground up, because it's very hard to build an app in English. And then after you've built the app, okay, now you realize it would be nice to add a Hindi version. That is very, very hard to do. Instead, if from the ground up, at the very beginning, you have to keep in mind that this is to be a multilingual application, and then thinking through of the user generated content also, because if people are posting content on your platform or they're making some posts, etc., then you have to make sure that your app is handling that in the right language. And also your support systems, a lot of times we build the app in different languages, but is the documentation in that language? Do you have training videos in that language? Do your support team, if you have a technical support layer, or even if you have an AI chatbot to support it, the AI chatbot should understand the different languages, right? So looking at it from a user perspective, one good way of looking at this might be that imagine a user who does not speak a single word of English. Can they take your app and just use it uh, from the start without any hiccups? And if that's the case, then I would say that's a really good place to be. Yeah. Okay. Uh, Jia Chandrapu asks, as engineering students, it feels harder to get into healthcare tech because of the vastness of it and the details of it. Any suggestions of platforms for tech students looking to get into healthcare tech and allied domains? Okay, that's an interesting one. I'm not sure if there is any uh, platform as such which allows you to just get a broad, sense of it. I would say yeah, it's a good question. I'm not entirely sure what would be the right way to get into it. I would say look at one particular problem, which, which sort of resonates more with you. So, for example, I feel there's a lot of opportunity in the hardware space as well, in terms of, diagnostics, in terms of using AI for detection. Early detection, I feel, is an area which is very, very highly, underpenetrated right now. What are some of those problem statements which you think you can solve? And getting deep into that, focusing on, because otherwise, if you try to study the entire spectrum, of course, in detail, then you will, it is very vast. I agree with you. So focus on one area which is something which you feel that is closer to you, based on what your skills are, what your interests are, whether it is software engineering, whether it is hardware, whether it is pure, data science and, AI development, etc. Of course, you would know the right focus for you. Yeah. Unknown users ask, a child's dead by same diseases, we can make the app, right? And what kindly of diseases? So yeah, again, see, the app may not solve the diseases directly, right? So our focus is not just on building the app. Our focus is create an ecosystem where if it is TB, if it is diarrhea or mental health or whatever it is, then the right knowledge should exist at the right place at the right time. A lot of the times you don't need an app to solve the problem. So I think rather than saying, okay, I need to build an app to solve for TB or uh, let's take any random disease, cancer. Um, so let's not look at it from an app perspective. I would say look at it from the end user perspective, like, okay, patients are dying of cancer. What can we do to solve that? Why? What are the root causes? Just ask, getting deep into the underlying problem statement first, instead of looking at it from a solution perspective. Because like I think a lot of times techies like ourselves, we are so attuned to coming up with solutions that we want to just build an app for something because we are all builders. We like to build things. Sometimes it helps just to take a step back and focus on the problem statement first, understand exactly what is the issue, and may or may not require an app also to be built. I mean, we don't have to build apps for everything, I think. Okay, where can we get real-time data sets for healthcare to build a model using that? I think there are a lot of open source data sets. I would say on Kaggle, you can check out some of them. If you look at the sort of open source ecosystem, there are definitely a lot of them. In India, I'm not fully aware, but there are also organizations. So for example, of course, a lot of this is collaboration based. So collaborating with Open Digital Public Good Alliance, there's many organizations who create open AHR systems. Now, India, of course, coming up with the ABDM and other things as well. There's also data.org. There's WHO, of course, has many open data sets also. So I think just you can do some research around it. I'm sure it depends on what type of data also you're looking at. Some of these data, especially in healthcare, is a little sensitive. So many organizations and countries are not very keen on sharing their data very openly. So I think that's where sometimes you have to sort of navigate that whole bottleneck a little bit as well. Yeah. Right. Gia's asked, making actionable insight and start. How do we ensure that medical advice being leveraged by AI is safe and will keep being safe over time? I would say a couple of things which we are doing. Again, we are not experts in this, but some of the things which we try to do is number one, uh, not to blindly trust the AI, firstly. Make sure there is human validation. So human in the loop is very, very important. So making sure your end-to-end user flows have some sort of human validation in place. Make sure that you are red teaming the AI also, like actually testing your AI, and you can use other AIs to test it also and do it at scale. Automation testing, making sure that different models are being evaluated. So it's a fairly complex process of building in that sort of trust layer in place, making sure it is not purely generative. There is some, that's what our approach right now is focused more on the retrieval augmented generation side. So which is not just taking the output of a large language model at its face value, but you basically give it um, a verified data set saying, okay, if the question is about TB, then here are the national TB guidelines of India, which are published by the central government. Here are the uh, other documentation which is provided by our experts in TB. Now, based on this verified knowledge set, now we ask the large language model saying, okay, now I want you to answer this question. And then once the answer comes around, then you can trace it back to the source material also, which is very important for us. So I would say traceability and human in the loop verification is very critical. Yeah. Okay. Let's see. Do you feel that feeding AI with data of patients can be harmful for their safety? And also, if we need to make reliable AI systems, will we need a lot of data? Will hospital help us access the data? Okay, first thing is yes, it is definitely something which we should not be giving AI. So please do not give AI your sensitive private health information. So definitely something which we do in our systems is a layer of anonymization. So all of the content which goes into our system there's no patient health information in it. So we actually do a process of de-identification. So any patient identifiers like their name, their ID number, their email address, etc., is scrubbed out. So it's basically a de-identified patient case, which comes into the ecosystem. And then, of course, on top of the de-identified data, there is a lot you can do. But creating what we call as in the industry as protected health information, or PHI, is something which we should not be putting into any large language model, unless, of course, it is compliant with these specific laws. There are some PHI designed AI systems, and there's a lot of checks and balances which you have to put in that place, because as per data privacy laws, especially outside India, India is still coming new with the DPDPA framework, but outside India, of course, these are very, very stringent GDPR compliances. There HIPAA violations in the US are something which you have to be very careful about. So our approach is always being very conservative in terms of giving any sensitive patient data to any system, whether it's AI powered or not. But especially if it is AI, then you have to make sure that you have all these checks and balances. And there are a lot of open source tools also which will solve this for you. So it's not something which you have to necessarily build all those de-identification mechanisms yourself. That's a good thing with open source, is someone or the other has already solved this problem. So just go on GitHub and find something, you should be able to leverage it. Um, Also, will hospitals help you access the data? Probably not, I would say, at least not the private hospitals. That's why you would have to look at some of these other approaches. And also, then again, the thing is, if it is PHI, then it's a very different ballgame altogether. Anytime you are interfacing with electronic medical records in the hospital systems, then you are dealing directly with patient information. Now, that is a very, very different ballgame, and then you get into all sorts of confidentiality agreements, and then liability. What happens if the data gets hacked and people's personal health records are floating on the internet? So then there's a very, very messy territory to be in. Frankly, we try to stay a little away from that right now. But yes, of course, that is definitely if you are doing direct patient intervention kind of stuff, then at some point of time you will be interfacing perhaps with some sort of PHI. But just having the checks and balances to reduce your risks and liabilities there, and doing it at the beginning, not just doing it at a later stage, I would advise on that. Yeah. Okay. Jaya is asking, if we create an app for health related issues, how do we know that we've created the app for them? Okay, so I think this is more of a marketing question. Like, um, how would you promote this app? Is everybody saying? I mean, there are a lot of ways you can do that. I mean, of course, when you're dealing with end consumers directly, then the marketing and promotion is very, very hard. Gets very expensive also if you're trying to, reach target specific, people with a disease. But I mean, if you do it through partnership model by going to, say, hospitals or partnering with the government, then that is another area which you can potentially look at. Yeah, I would say doing it on your own is going to be very hard. If you like built an app for, let's say, mental health, now how would you get the app to potentially millions of people who need to see the app? I think, yeah, probably best to go through some sort of existing patient networks rather than doing it on your own, especially if you don't have the funding for it. Yeah. Okay, if you're starting this question, this is a good question. If you're starting the company again today, what technology decisions would you change? I'm not sure what technology decisions I would change exactly, but I think AI definitely would be more front and center, I would say, in terms of how we were looking at it. The other thing is, because for us, it's not just about product which we are building, it's about what our partners are doing. So we work with over 1,500 partners. So these are government institutions, these are medical colleges, these are ministries, etc. So it's not just about what we can do, right? We have to listen to our users and make sure that they are finding value in what we're doing. So I would personally like to do a lot of things differently, but it's also a question of what would be the acceptance in the ecosystem. But I would say technologically, probably we would keep it yeah, fairly similar. Maybe one thing we could have kept a little bit in mind would be making it more mobile friendly to begin with, because Echo is going on for many years and it was primarily around laptops and being in a screen, because you have to do a screen share and in sharing case presentations and all that. But nowadays, I think if it was more voice-based and more mobile optimized to begin with, of course, we have a mobile app, but it's not like core mobile first. So yeah, maybe a little more mobile heavy, more voice based, and a little more AI, I think might be some of the things we would change. We are already working on some of these. So yeah. Okay. Radha is asking, can a mental health chatbot be useful? I would say, again, I'm not entirely sure. I'm not a mental health expert. I think with the right guardrails and the right checks and balances, perhaps. Um, and there are some studies which show that people in a blind test they were able to see that many chatbots could operate at the same level as like a trained counselor. So again, if it is democratizing access where people cannot afford to see a counselor or a psychologist, but this could replace it and it's done in a safe ethical manner, then I'm sure it could be useful. I think there's a lot of unknown things over there as well, because at the end of the day you do end up sometimes inadvertently creating dependence on these systems. So anytime you're taking away human to human interaction, replacing human to human interaction with a human to AI interaction is something which I'm not very comfortable with. But I can totally understand that when there is no access to the uh, human to human interaction in this case, then at least something is better than nothing, right? So I'm sure it may be useful in that case. Yeah. Rohan's asking, healthcare with AI comes with a lot of challenges. I completely agree. I think there are a lot of challenges. I think there are a lot of opportunities also. So the question is always like, what is the trade-off over here, right? So the challenges in the sense, um, of course, there's definitely the AI can get something wrong. There is hallucination. It may, people, and then there are some documented effects of this. Like, there's some chatbot. People chatted with Chat GPT, and the person, regrettably, they ended up committing suicide and all that. So there's definitely some negative cases of this also. But I would say there's a lot of positive cases as well. So I mean, challenges are there with any technology. I think you just have to use it, safely. The same thing we see with social media, right? Social media has a lot of challenges. If people are, especially teenagers, are getting addicted to, social media applications, and there's a lot of the psychological impact of these social networks. So I would say the same thing with AI as well. It has a lot of challenges, has a lot of potential also, has to be done safely and ethically. Yeah. Can we start a project which exists in other cities? Uh, Not in mind. Like for example, AQI monitors in Odisha. Absolutely. I would say wherever there is some validation of the technology, but is there's a geographical gap in a particular region, then definitely. I think AQI, yeah, I mean, if there is a gap, again, the question to ask over there is, okay, does AQI do you even need AQI monitors in Odisha? I mean, what is the fundamental problem you're trying to solve? Um, is it access to data? But then what will the access to the air quality data really give, and how will it be utilized? I think there's some more questions to be answered around that. Yeah. Okay. Okay. Based on your experience, what would need to be true about the solution for you to trust it enough to back it publicly? Uh, So I would say it depends on what you're trying to solve. Like if you are building something which is directly helping patients, like many people have said mental health, but there are other areas where you can, let's say it's a early detection of some diabetes or some disease or something. Now, um, a lot of times the data can be very misleading if it is not properly analyzed using like a randomized control trial or some sort of reasonably well structured evaluation. I think in healthcare especially, um, the bar is very high on evaluation. We also do a lot of evaluation for our work. The gold standard is an RCT, but RCTs are very expensive and very difficult to do. So there is always, is there enough evidence that the data, one is of course you should have a large enough data set, but it's not just about numbers, because what is the sort of blind comparison? As in some sort of blind comparison saying, okay, this intervention, whether it is an app, whether it is a device or whatever it is better than the others, and there is some sort of placebo or some verification also, because we see that the placebo effect is very strong in healthcare. That's why so many uh, you know alternative medications and all that work is because people just believe that it works and it actually does work because it's a placebo essentially, right? So you have to control against these things. You have to make sure that you have a proper evaluation in place, and otherwise it's easy to get some data and show that yes, it's working, but the bar is pretty high on it on this personally, I would say. Yeah. Okay. Manikar says, which scheme of the government is trying to protect patient data and giving them control? So there are few, I mean, there's no scheme as such, but firstly, there's a legal framework called the DPDPA, which is a digital data protection something. I forget the acronym. So this is a new act which is based on the sort of European Union's GDPR compliance. So that's more about giving the rights to the end users on, like, you can basically ask, okay, what is my data being used for? You have to make sure consent is taken from users. You can't just misuse people's data and give it to the AI companies and all that stuff. So that is something which we are starting to see getting implemented. We are also working on that, making sure that yeah, patients have control over their data protection. Yeah. All right, few more. How can we reach rural audiences if we are building an application? Oh, good question. I would say in general, yeah, firstly make sure that it works without Wi-Fi. We see Wi-Fi is a big challenge in remote rural parts. Also, again, not all rural parts are the same. There are many rural parts of India which have very good internet connection also. There are many parts which have very, very poor internet connection. A lot of times it's to do with the terrain, like hilly areas will have challenges. I would say if possible, make sure it works offline as well, because a lot of times you will have cases where the network is there and then it goes away and then it comes back again and then sort of it goes back and forth. So making sure that the access to internet is kept in mind. Now, how do you promote the app to them, and what kind of marketing and other promotions can you do? I think that is something which we've already discussed. Um, Okay, there are a couple of more questions. I'm not sure if we have time for all of them. Um, uh,
You
I
can
know.
take only one or two questions and then we can move.
All right, thank you. So let's see what we have. Mistakes that junior developers will make when building healthcare products. Interesting. I would say one is don't think of yourself as the patient. A lot of times we look at solving for ourselves, which is good, of course, but a lot of times the real world looks very, very different. So first thing is understand who the real world is. Go to a hospital and see actually what happens. So it's not necessarily the tech part; it is an understanding of the ecosystem part. Just sit down in a hospital, go to the OPD and just see what is going on. Talk to some doctors, just get involved in the ecosystem, understand your user base instead of just building the app. I think we like to just build things without understanding the fundamental problems first and foremost. And yeah, let me take one more question then. The mental health case. Okay, I can share more about that maybe offline. It's a long intervention which was done in Bihar with NIMHANS. And what as a mental issue cannot be cured can be maintained. I mean, again, sorry, I'm not a mental health expert, so I don't think I can answer that question. So thank you for your time. And yeah, I mean, please feel free to reach out to me. I'm sure, Payal and others will share those details soon as well. So once again, thank you for having me and appreciate all the questions. It's been a very interactive session. Thank you.
Thank you to you for answering all the questions with so much patience. Thank you so much, Kartik, for that enlightening session. Your insights on healthcare gaps, the echo model, and the role of AI in healthcare was truly inspiring. Thank you so much.
Thank you, Karthik. Yeah, see you.
We'll now have a lunch break. Please take this time to relax, recharge, and reflect on the exciting ideas and insights shared so far.